So I'm joined by Florencia Pistrito. Did I say your name right?
Yes,
Oh,
yes,
good.
perfect.
So thanks for joining us on Post-Exertional Mayonnaise podcast. And we were just talking earlier about your sort of condition and diagnosis a little bit. But would you like to tell us a bit about your chronic illness journey and kind of how grief has played a part in that?
Yes, of course. It all started in 2014. I had a pain in my knee, completely unexplained, and I was going to a GP, and they used to give me ibuprofen, but every time it was getting worse. It would go away for a while, coming back, and I didn't have any injury, anything that would explain this. Well, the pain got unbearable. It would wake me up at night. I had sweats all the time. I was losing weight. And finally, I demanded an x ray. And it came back, they could see. They told me that it was, or whether a really bad infection or a tumor. And then all the process started to
Mm.
get diagnosed. I got an MRI scan, a needle biopsy, and I was told that I had osteosarcoma, that is primary bone cancer, which is extremely rare. It affects 1 in 1 million.
Mm.
And it's normally a childhood
Wow.
cancer. It can happen to people under 30 years old, but it's normally children and teenagers that are still growing. And
Mm.
then, well, I started the treatment. The treatment was absolutely brutal. It was chemotherapy. Then these tumors, they don't shrink with chemotherapy. You always need surgery.
Mm.
And because of the location of the tumor, that it was in the tibia, the surgery is really, really complicated. They had to take the muscle of my calf, they put it on the front of the leg. So it's not only that they have to remove the tumor, you get what it's called a megaprosthesis. It's not only the knee, it replaces the tibia, a part
Mm.
of the femur, and that surgery plus the chemotherapy, I had an abnormal healing response. And that's when I got arthrofibrosis. The leg was never functional, and it got stuck in extension. I can't bend my knee at all. And I recently went to see a specialist. There are very few specialists about this disease. And they told me that I have a mass that is blocking my joint. And he said that it's the size of half of an apple. It's a mass that I have.
Wow.
In Well, I was in night treatment. I wasn't told what I had. There were a lot of lies and gaslighting. I was told that nothing could be done,
Mm.
and it turns out that it's not true. And they should have been treated on the early onset of the disease, because even now, if I have surgery, I will never make a full recovery.
Mm.
And it's
Mm.
extremely problematic because
It's that.
if you think about daily living activities, you need at least 60 degrees bend to walk, um, and 90 to sit down. It's very, very complicated because I have this walking disability, and it's incredibly painful. It affects other parts of your body, the hips, the lower back, the
Mm.
foot. And now I have this problem that no one wants to do surgery on my leg.
So it's almost like a vicious circle because you need the surgery, but there's not an outlet for that to happen for you.
Yeah, I mean, in Scotland, it's never going to happen. I tried many specialists.
Right.
They say that they won't do it, that it's too risky. But I know that the surgery, from a scientific point of view, is doable. I want to do it, even to recover part of my mobility, because it won't be perfect. I wouldn't ever get to 90 degrees. And another problem it is that with these prostheses, then there are parts that you have to replace because they don't last forever. They are very durable, but you have to replace some parts. And that's my concern, that no one will want to touch my leg again. And I'm being denied a referral to an orthopedic hospital in London, because there are specialized hospitals, which in Scotland we don't have that.
So it must feel really hard, kind of like just being stuck in a situation and almost knowing that there might be a solution, but not being able to access that must be very frustrating for you.
It is, and very depressing, because naturally I don't want to go back to the consultants that did my first surgery, because as I've been lied to, I don't think I can continue with them, because that's a reporting bias, and I think, what else are they going to lie about? Because the mentality a little bit in this world, the bone cancer world, is that you are alive. It's all that matters. There is no focus on quality of life. All that they care about is that there's no cancer. So in their books, the surgery was successful, and it's a disaster. I lost my ability to work. I lost my job. I lost my home. I had to relocate. I used to live in Edinburgh. Now I live in an isolated, semi-rural area. They cut us off transport. And the problem is, when you have a disability and you can access those things, that you need to live with it. That is not luxury. I need a car. I need accessible housing. I live in a house with stairs, for example, and in this last summer I fell down the stairs and I broke my kneecap. That is the only part of my real knee that I have left, and I needed surgery to fix it with screws, and actually it made me worse. I could bend a little bit more. I had like 20 degrees bend, and now I have 5, which is it's so painful. And what it was is I never understood my symptoms until I joined Twitter, and I started to read about people with chronic illnesses. The chronic pain makes you exhausted. I can manage activities of daily living, and work was a problem. I became a freelance linguist, and even then, that I used to work a couple of hours, I was exhausted. Every time I go somewhere, it takes me a few days to recover. It's horrific. That's the part that bothers me the most. Now, I don't have energy because, the world goes on, even if you're not feeling well, and not having. I don't have benefits for disability. I have a PIP, but not even the full rate that I should be getting. My mobility is away, my disability affects me, and I have a low mobility component. And they would argue that it is because I'm not an amputee, because there is a lot of ignorance about this condition that I have. And there is a taboo also in the medical community. They don't even want to mention it. I was never told it's arthrofibrosis until, I was Googling, I found a specialist in London, and I went to see him. And the problem is that the private sector is not sufficiently developed So if you don't have treatment on the NHS, then for surgeries they don't have the facilities, they don't have a team. So this surgeon is very knowledgeable, but he doesn't have the resources to treat me in case we have a complication. And because I am in this situation now, because of the complications of the initial surgery, that concerns us obviously. Because what would I do if I get another complication? And I don't think it will ever happen on the NHS. And it's so frustrating because they are the gatekeepers of the treatment, and once you are not doing well, they don't want anything to do with you. I am really shocked to find out that there is this ableism in healthcare settings, because I wasn't even offered help to manage this condition. I should be seeing a rheumatologist, because I don't know if what happened to me in the first surgery. I think I have complex regional pain syndrome, but I was never diagnosed with this. Because people that I consulted, experts, they told me the pain that you had after surgery, that was disproportionate. That's not normal. That the pain should have resolved within 2 weeks. And I don't know, I was taking morphine for 2 years after the surgery. And the problem is that they tell you to exercise, to do physiotherapy, while you should be not doing physiotherapy when you're in pain. You need to control the inflammation levels, apparently. But of course, I didn't know any of this. I had no idea, because I have never been sick before this. So I had no idea about what's normal and what's not. It's really frustrating.
It feels quite similar. Yeah, it feels quite similar to my condition ME, in the sense that if medical professionals can't do anything, they're not, like you say, they're not interested. It's almost like a god complex that actually, well, if I can fix it, that's great. If I can't, or there aren't the resources, then goodbye, sort of thing. It's almost like, well, there's nothing we can do for you, so therefore I can't help you. So therefore that's not gonna sort of help my ego. I don't know if that's true or not, but it feels like that sometimes, that there's just a sense of not being listened to, and with your pain, it sounds like that was the case, that actually it's not going down the normal route of recovery of what we would expect, so therefore there's nothing else we can do for you, sort of thing, or there's no signposting to resources or support for you when you're in that situation, and it sounds devastating really for you, and it feels like that's where the grief comes in, but it's a grief that you can't resolve for yourself, isn't it?
Exactly. I am very depressed about all this situation, because, they treat this problem as it is a problem with range of motion. But recently, there was an association about an arthrofibrosis association, that they are trying to educate people about this, because all that I could find online before, I never thought I had it, because it was of people that had it and it resolved. So I didn't think that it was this, because it's like, no, mine, the physiotherapy didn't help, so I don't have this. But now there is more information out there, and it's kind of like an immune condition. The hormones are involved. It's such like a complex process, and it's different. For example, the shoulder arthrofibrosis, it resolves by itself, but it's not the same in the knee. So there are people doing research, seeing like, why is this happening, and it has to be someone that knows how to treat it, because if it's someone that is not familiar with the condition, they can create more tissue. more scar tissue, when they operate.
Mm.
So there is a
Wow.
certain tool that needs to be used, and it has to be a minimal blood loss surgery, which is, imagine open someone
Mm.
and trying to do like a minimal blood loss surgery is really challenging. But it is a
Mm.
common
Yeah.
complication from surgery. So that's why I'm so puzzled, because it's not uncommon. And because there is this reporting
Mm.
bias, there isn't enough data about the condition because people don't report it.
Mm.
I think that's why what happens with all of us. We're being told that nothing can be done, so you stop insisting, and there is there is no data. But I can't believe it because it's a complication, so there is no accountability. Because
Mm.
well, it was my immune
Mm.
system that did this, but I didn't do surgery on myself. you know and
Wow.
also I found out
Mm.
about people that had treatment for this. So they should let their egos aside and say, I can treat you here, I'm gonna refer you to someone that can in England, or
Mm.
because in here I don't think they
Mm.
have any intention of ever treating this or researching it. Once I was the way that a surgeon was greeting me, he told me, I don't deal with stiff knees. So basically, they
Mm.
want, as you were saying, they want a patient that has no complications when everything goes
Mm.
according to plan.
Mm.
But that's not the reality. And for
Mm.
me, it's the lack of transparency as well. And I wasn't warned about this risk. I think every single person that's having surgery should be warned because, even with smaller surgeries, this can happen. Imagine that you're a person that goes through a knee
Mm.
replacement because you want a better quality of life and you end up getting arthrofibrosis and then no one wants to treat you.
Mm.
And there are cases, I
Mm.
join forums on Facebook. There's a man that got both his knees done, and he got it in both knees because there can be a genetic predisposition for that, and apparently it's more common
Mm.
in women because of the way that the immune system works.
Mm. Interesting. So, um, are there things for you that like instigate grief? And I guess it's a constant living grief for you, isn't it? And how do you manage that personally? Are there things that you do, or is it a case of like taking it a day at a time because the future seems so uncertain for you?
Yes, I am trying to. I'm studying at the moment. I'm finishing actually a degree, which I'm really struggling because I struggle to
Mm.
keep myself awake. And
Mm.
I'm hoping to be able to work as a freelance translator because the interpreting, because it's public services, it's underfunded, and I can't make a living with that. Unfortunately, it was a good experience,
Mm.
but I can't make a living with that.
Mm.
So I'm hoping translator or maybe find some remote work, some company that values bilingual people, something to work from home because going to places is difficult. I can afford a card. Um, it's not being able to afford the things that I need to live as a disabled person. That's the worst. And
Mm.
another thing that happened to me, it's like my son. The same month I was told that I had cancer, he got his autism diagnosis. So it was double grief
Oh.
for me because I had dreams for my son, and he won't be able to live independently He's completely non-verbal. Has an intellectual disability as well, because that autism is a spectrum and affects people differently. So in the beginning, I focus on him. I hire people to work with him because he had a lot of behavioral problems when he was little. He's doing great now. He's a happy child, but of course, I need to provide for him, and yeah, this is my worry, about the future, about how is it gonna be for me and for him.
Yeah, well, thank you really for telling your story. And I think there's something really powerful about telling our stories in these situations in terms of how we've progressed through kind of chronic illness, and it's fascinating to hear what's happened to you. But I really feel for you in terms of kind of like your situation, because it's almost like you're stuck in a situation that you don't want to be in, and it's frustrating, and there's not an easy way to manage that emotionally, is there, when you're exhausted by pain and things like that. So have you got any thoughts for other people that are in a similar situation? And I know that you help administer a group for people with osteosarcoma and Ewing's sarcoma. Is that something that if people aren't aware of, is that something they can access? Is it a Facebook group or?
Well, I joined that group when I was on treatment, and it was my lifeline, because of course I was at the hospital and no one else had it. I was in a room with there were women with breast cancer, and because their treatment was very different, they weren't feeling as bad as I felt, and they felt like chatting. And I had my son in foster care because I was a single parent. I was away from my son with a treatment that I thought the treatment would kill me because it was so harsh. So I wasn't up for a chat, and also I had nothing to do, nothing in common with these women. They were older, their children were grown ups, like nothing to do. They had a cancer that was less aggressive. So I used to shut my curtains, and I found that group, and it's great because people use it to vent, or even because there's things that doctors don't tell you. So we give advice to each other, like like mouth sores are killing me. What did you do about this? Or anything, and surgeries. It's very normal that people are left in limbo, with the surgeries things, because when you need a revision, that is really common, they try to delay it as much as possible. But that is so bad for your head, and also I don't understand why they have to wait until, I don't know. What about if my leg starts falling apart, and it won't be a planned surgery? Maybe I will need to rush to the hospital because I have a loose component, and my bone could break. What if I am alone in the house with my autistic kid and that happens, because I have seen another person that, yeah, she was in the house, and suddenly the bone broke, like, like the prosthesis got loose, and she needed to be rushed to the hospital in an ambulance. So why not planning the surgery properly? And I want to be matched with someone that can deal with my problem, because I don't think that the orthopedic treatment that I got, it was appropriate for my condition, for my sex, and for my age. Because there were a lot of things to consider. I told the surgeon I wouldn't be asking you for a revision if I were 85 years old with 5 years left to live, but it kills me to think that I would need to live like this for the rest of my life. And it wasn't my choice, I feel like I'm not being able to make decisions about my own body. So I feel completely out of control. And I don't want the NHS making decisions about my body. I live with a disability because they chose to leave this untreated. It's insane. Instead of thinking this person, I was 29 years old at the time. We need to give this person the most functional outcome possible. That would be logical for me, but there is no focus on quality of life, and that's what all the other survivors are complaining about. Because there will be side effects from the treatment. I'm very lucky that none of my organs are affected, but there's people that had this treatment that they are on heart medication for the rest of their lives. There are people that needed a kidney transplant because one of the chemotherapy drugs is really toxic for the kidneys. So in that sense, I was really lucky. But the problem is that when people see me walking like this, they won't employ me. And for the department for working on pensions, I'm not disabled enough. So I am too disabled to work, but not disabled enough to get benefits. And all that you want is to survive a disease with dignity. I don't think it's so much to ask for.
No, it feels like, and that's very much the case for those of us with ME as well, that we there's such a lack of understanding of the condition that it's hard to get the benefits, but at the same time, for many of us, we can't work because of the impact of activity and causing flare-ups of our condition and causing severe exhaustion and a worsening of our condition. So there's a lot of similarities there, and a lack of understanding from the DWP and the government in terms of acceptance and what it means for us to be able to work or not. And I really feel for you, and
it's
thanks for
horrible.
sharing your experience.
And some people might say work from home, but some people are not well enough even to work from home. And do you have the luxury of having a room dedicated to an office? Not everyone has that. And some people are forced to work, and the working makes you worse. When I was working as an interpreter, that I had to commute, and I was called from different parts of Scotland, traveling in trains. It was exhausting for me. And apart from that, it's all the jobs. You get some trauma from them. So I was dealing with my own trauma of the cancer, and that was very bad for my mental health. So I don't want to do it anymore. As much as I love the job, it's I'm not in a good place mentally to do it, because all the assignments are confidential. We can talk to anyone about what happens in those appointments, and you get to see all sorts of stuff. We was working for the public services, hospitals, charities, council, police, court. But it's not well remunerated for what it is. It's a job that's really, really hard to do. It's not an experience that I would eliminate, because rather than doing nothing, I got that qualification, and now I'm getting the translation one to see this gets me somewhere. I feel that because I'm disabled, I need more qualifications, to make it up,
Mm,
because I can't use my body
mm,
anymore to work. I used to work hospitality
mm.
jobs before this. And another thing it is
Well,
that, because
thank you.
when you and you must get the
God.
same problem when you are young. People believe that you are fine. You are young. You can't be sick. You can't be disabled. There
Mm,
is a prejudice as
mm.
well, or oh, you look well. Yeah, but you can see what's going on inside my body.
No, no, that's a really valid thing that, we talk about invisible illnesses, don't we? And yeah, I feel that personally because I'm mostly housebound, and then when I do very occasionally get out on a rare occasion to maybe like a family gathering or something that people see me and think, oh, he's doing well or whatever, but I've like overstretched myself just to be there in the first place, so it's
You
it's
push your body, yeah.
it can be deceptive. Yeah, yeah, and then you feel the after effects afterwards. So it's
Hmm.
yeah, there's so
That's
many
what I get
different
to.
things involved, isn't there? So, well, thank you for your time, and I think we'll probably like leave it there in terms of the recording. But there's
Okay.
so many really valid themes that you've picked up in terms of like the NHS and an element of ableism there, and being sort of stuck in a situation that you can't get out of, and also um, that experience of kind of like how you're seen and perceived in society as well, and they're all like really valid things, aren't they? So thank you so much for sharing. Florencia, and maybe if you want to send me details of your Facebook group if people are interested,
Oh yes, of
and
course.
particularly that would be really good, and I can put that in the link for the in the video as well. So, thank you very much.
Thank you. Have a lovely day.